Hi everyone, my name is Mazrena binti Mat Kasim. Welcome to the module of NUR 251 Reproductive and Sexual Health Nursing. Today we are going to learn about topic of abortion. This topic will be divided into two parts. The first part I will cover on the definition, the etiology, the type and clinical manifestation of the abortions. For this topic, this is a learning objective that you will learn. As introduction, human reproduction is hopelessly inefficient. The maximum probability of conceiving during a menstrual cycle is only about 40%. One third of conception do not result in the delivery of baby. But this inefficient process produces astoundingly good outcomes. The vast majority of continuing pregnancy result in the birth of a healthy human being who will eventually pass his or her genes on the next generation. Miscarriages, clinically detectable pregnancy that fail to progress, are the inevitable byproduct of such a process. They are common and even remain unexplained even after investigation. This pie chart shows that percentage of miscarriage in the first 20 weeks of pregnancy. As you can see, 80% of miscarriage happen before 12 weeks and 20% of miscarriage happen between 12 to 20 weeks of pregnancy. Now let us move to the definition of abortion. Abortion can be defined as termination of pregnancy or early pregnancy failure, which is early pregnancy loss, will lead to the miscarriage, and abortion is a miscarriage. In other words, abortion can be defined by bleeding through the vagina before 20 weeks of pregnancy, or output of pregnancy product before 22 weeks is either spontaneous or designed, or output of the fetus or embryo through a birth canal where the weight is less than 500 grams, or the expulsion of the fetus before 20 weeks of gestational age. Abortion can be divided into two types, which is spontaneous abortion and induced abortion. This picture shows that 4.5 months old little girl deliberately and intentionally burned by saline solution, and the doctor used to abort her. What is the spontaneous abortion? Spontaneous abortion is a non-induced embryonic or fetal death or passage or product of conception before 20 weeks gestation. A miscarriage may also be called a spontaneous abortion. The incidence of spontaneous abortion is about 50% of all confirmed pregnancies, and majority happens in the first 3 months. There are 5 etiologies of spontaneous abortion, which is first, maternal age, which is common in the older woman. Second is structural abnormalities of the genital tract. Third is the maternal disease such as diabetes. Fourth is the infections. And fifth is environmental factors such as excessive intake of alcohol, coffee, and cigarette smoking. This picture shows to us about partial birth abortion. Currently, there are 6 types of abortion, which is threatened abortion, inevitable abortions, complete abortion, incomplete abortion, silent or delay abortion, and septic abortion. The predisposing factor for spontaneous abortion can be divided into two, which is fetus factor, which is include congenital fetal malformation, chorion abnormalities, seed implantation abnormalities, chromosomal abnormalities, and hydatidiform mole. For the maternal factor, which is include of endocrine disorders such as diabetes, hypothyroidism, and hormonal imbalance, which is progesterone deficiency. And the other factor is a mother's disease such as mothers is having syphilis, rubella, hypertension, renal disease, immunological factors such as severe rhesus immunization. Other predisposing factors include of medication, which is taken by the woman, which is quinine and cytotoxic drug. And another one is a trauma such as fall and accident, a blow to the abdomen. And nutrition can be also the predisposing factor such as malnutrition, deficiency of folic acid, which is help in the formation of the fetal nervous system. Other than that, uterine overdistensions, uterine abnormalities, and chemical agents such as tobacco, alcohol, and mercury also can be predisposing factor for the spontaneous abortion. The first spontaneous abortion is threatened abortion, which is bleeding through the vagina before 22 weeks of pregnancy and threatening pregnancy. This os is closed and the content can be saved. The sign and symptom for the threatened abortion is a pain like a period, scanty bleeding, cervical os will be closed, uterus will be soft if palpable. The second type of spontaneous abortion is inevitable abortion, which is unavoidable miscarriage or rescue. There are two types of inevitable abortion, which is complete abortion is miscarriage of all content or product of conception. And second one is an incomplete abortion, which is incomplete product of conception miscarriage. The sign and symptom for the inevitable abortion is severe pain, heavy bleeding or clot, cervical os will be open, uterus tender and painful. The third type of abortion, which is misabortion, which is miscarriage where the fetus is dead but does not come out of the uterus. And habitual abortion is a miscarriage that occurs spontaneously in row 3 times or more. The fifth type of spontaneous abortion is complete abortion. The sign and symptom of complete abortion is a severe pain, heavy bleeding or clot, cervical os will be open, uterus tender and painful. And silent or delayed abortion will be present with the symptom of no pain, some spotting, cervical os is closed, and uterus will be smaller than expected. Now let's move to the induced abortion. Induced abortion can be divided into 3 categories. The first category is a therapeutic abortion, which is a miscarriage that can be done due to danger to the mother's life. Example of therapeutic abortion is mother who suffer from the chronic diseases such as heart disease, severe preeclampsia, and the risk of giving birth to a mentally ill baby, and last one is a rubella infection in the first trimester. The second category is the criminal abortion, which is miscarriage performed without a health reason by an unqualified person. And the third one is a septic abortion, which is an infection that occurs following a miscarriage or misabortion. We already know about the type and definition of abortion. Now, I will explain on the clinical manifestation for all type of spontaneous abortion. For the threatened abortion, the client will present with the minimal bleeding, or closed when vaginal examination is performed. Fetus does not come out or still alive. The client remain in place and experiencing mild abdominal cramp. For the inevitable abortion, the patient will having there is a lot of bleeding from the vagina, abdominal pain, abdominal cramp. While vaginal examination also look open, the amniotic membrane has ruptured and the miscarriage can be complete or not. For the complete abortion, the symptom is bleeding come out when the product of conceptions come out. The pain disappear when the miscarriage is complete. And for the incomplete abortion, the sign and symptom is a persistent bleeding from the uterus, abdominal pain because the uterus tries to get rid of the product of conception left behind, while the vaginal examination is open and urine pregnancy test is positive. For the missed abortion, the patient will having a symptom of the uterus does not grow, the breasts are not tense, nausea and vomiting stop, urine pregnancy test negative, slightly discharged and brown discharge, while the vaginal examination was closed and tight. When the patient is having habitual abortion, they might having cervical incompetence in gestation 14 to 16 weeks of pregnancy, natural defects such as hydrocephalus, the placenta is amazing, low-lying placenta, uterine fibroid, ABO and RH incompatibility, hormonal imbalances, cervical erosions, and laceration. Induced abortions are having three categories, which is therapeutic abortion, which is termination of pregnancy due to the maternal health. This is the termination of pregnancy before 20 weeks of gestation. The indication for the therapeutic abortion is continuation of the pregnancy may cause emotional or financial hardship. The woman is not ready to become a parent. The pregnancy was unintended. The woman is pressured into having one by her partner, parents, or others, and the pregnancy was the result of rape or incest. The second category of induced abortion is criminal abortion, which is deliberate termination of pregnancy, and the third category of induced abortion is aseptic abortion, which is too high a body temperature, also delirium, smelly, bleeding or discharge, feel sore and tender in the lower pelvic abdomen, high vaginal swab result for the culture and sensitivity is positive, and patient is having septicemia. That's all for the part 1, and I will continue this topic on the part 2. Thank you for your attention, and I hope you learn this topic. Thank you.